Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you, just after 10 minutes on the clock of 4 o'clock. I'm Khawa Solomon. Thank you, Shukran, so much for joining us. Are you at home? Is the main question. Are you in quarantine, self-isolation? Are you listening to the government's rules and regulations when it comes to COVID-19? We are in our 21-day lockdown, and this is a brand new show. Welcome to it, Health Matters Extra. We appreciate your time. Please join us every Monday, Tuesday, Wednesday, the weekdays, Monday to Friday from 4 to 5 p.m. Inshallah, we want your interaction, so please do take down our WhatsApp number. We will not be taking any live calls, but we want you to interact with us. We want you to tell us what are your concerns with regards to COVID-19. What are your circumstances in this lockdown? Are you following the rules of regulations? Is your family and your friends too as well? We want to connect with you. You are at home, some people in isolation, and there's various aspects that they might find challenging. So please do connect with us on Health Matters Extra. Our WhatsApp line will appear at the bottom of the screen. So please note, taking you through the content of the show, it is day 11 of our 21-day lockdown. There's rumors, there's talks, there's questions around if it's going to be extended or not. So please follow the latest news and follow the reputable news channels, including ITV networks. So looking at our first segment and understanding that the IMA, the Islamic Medical Association of South Africa, plays a big role in putting together Health Matters. We must show them a big appreciation and a big thanks as well. Today we have a slogan which they are promoting called "Wash your hands and stay indoors." Hashtag COVID-19. So what does it mean to wash your hands? They're saying wash your hands for 20 seconds, soap them up nice and lathery for about 20 seconds to get, and why do you want to soak them up for 20 seconds? We're going to be playing a video for you in a minute or so, but the IMA is saying wash your hands and stay indoors, hashtag COVID-19. So it's about happy birthday twice, wash your hands for 20 seconds, count happy birthday to you again, and then knowing that a big thank you to Dr. Diaz Ishmael and his team and the rest of the IMA guys for providing us the information on wash your hands. So we'll also be playing you a short video clip, and it will exactly tell you how to wash your hands. Very cute, to get the family and everybody involved. Soap your hands for about 20 seconds. Remember, that is happy birthday twice. A wash, and then we must also remember we want to save water. So part of, me coming from a water restriction area in Cape Town, landed in Johannesburg, still realizing that we need to save water. So then open your tap and then wash your hands, rinse it off nicely. Remember, you've lathered it nicely and soaked it up for about 20 seconds. And also remember, when there's no soap and water available, use a hand sanitizer that is 70% alcohol. I know the price of hand sanitizer is going up quite a bit, so please connect with everybody if you know where it's a little bit cheaper. Know that through the rest of the show we'll be interacting with people on the ground as well. We'll be chatting to an organization who is offering their help, and we'll do that throughout the shows of Health Matters Extra. We will be chatting to Shana based here in Johannesburg. She is currently under quarantine. We'll be speaking to various guests, paramedics, nurses, essential staffs on the ground to find out what is happening with them and in their circumstances. They've left their family at home, going out in the COVID-19 environment and coming back home. So what are they doing to protect themselves? We'll chat a little bit later to Professor Shabir Mahdi, who is former ex-executive director for the NICD, and we understand that he has a really long, reputable CV and involved in pediatric infectious diseases as well. We chatted to him about a week ago or two. So send through your questions if you have any concerns. We are talking and focusing on lockdown. What does the quarantine involve? What do we need to know about going out for essential goods? And when we're coming back, the situation with South Africa, overpopulation, the shacks, in various informal settlements. These are all things that we're going to be talking about. But remember, hashtag wash your hands, COVID-19. Take a look at this video.
Wash your hands! First you need some soap, then scrub for 20 seconds. If you don't have a clock near you, then sing the ABC song. Be sure to scrub front and back, under your fingernails, and between your fingers. Dry your hands with a clean towel or a paper towel. For more information, go to www.cdc.gov/cleanhands.
So there you have it. Get your children involved. Do it like a little exercise, even if you're not washing your hands really clean. Now take a bucket with water and practice this whole lathering for 20 seconds. And remember, save water. So maybe reuse that water, because we're going to be washing our hands quite a bit, and use it for the washing machine or throwing it down the toilet. But remember, we have to save water in every instance as well. So our guest now and our correspondent is currently an individual who is in self-containment. She's in self-isolation quarantine. We're not too sure. We're going to check that out and find exactly from her. She's also a paramedic. Let's link up with Shana Davids. Assalamu alaikum to you.
Wa alaikum salam, Khawa. How are you?
I'm good, alhamdulillah. The big question is, how are you doing?
I'm good, alhamdulillah. I'm having a better day today.
Alhamdulillah.
I can't say that I'm feeling any different, just a bit of flu-like symptoms, but I've decided to, with my GP's advice, to self-isolate for a while.
Okay, so tell us quickly, Shana, why are you in quarantine or self-isolation?
I'm in self-isolation. So what happened was I traveled for business to Cape Town mid-March, came back on the 18th, and about a week later started feeling a bit of, the different symptoms and that, and contacted my GP. Because I've got a pre-existing condition, I contacted my GP, and she advised to, because I fall also into the high category risk, she advised that I self-isolate. She also advised that I go for testing.
Okay.
However, I thought, as a paramedic, I'm going to monitor myself and see how it goes, because I just feel that, people like us, we some of the lucky ones that can self-isolate, monitor the condition, and then if it gets worse, we can always go to a hospital, and not waste a test kit in that sense. So I'm self-isolating and just taking it day by day.
So Shana, as a paramedic, you understand self-isolation, but to the layman, how do you explain self-isolation and following that rules when you do decide to self-isolate?
I think how it's very, very difficult from what I can gather from seeing what's happening out there. People are just not listening. So it's very simple. Don't stay indoors. People like us and paramedics and doctors who are really putting their life on the line, they go out there and they're going to sacrifice their lives and their families' lives for you out there. So stay indoors. Listen to what the government is saying, because it's not a joke. There are people with pre-existing conditions. I'm one of them. There are old people that have really, really, pre-existing conditions that could land them in hospital, in ICU, can even see fatalities in this sense. So I would say just listen to the government, stay at home, don't be stupid.
Okay, so you've just mentioned now you've got a pre-existing condition. Do you have any fears if your test does come back positive for COVID-19?
I actually don't, because I look at it as maybe it's just a simple thing, and maybe I shouldn't have a fear. I don't know, but I look at it as having the flu. And if it does get worse, I know what to do, where to go, reach out for help. And I've got access to, alhamdulillah, we're privileged that we at least got access to hospitals and all that. But no, I'm not really fearful. Even if I do test positive, I've spoken to many of our colleagues and people out there who do have it, and they basically say it's just like a flu. So I have to just excuse that's the parrot in the background.
Okay. I hear him. Quickly, your message to South Africans and to people watching now all around the world, what they need to know when it comes to the reality of COVID-19, just in your opinion, layman opinion.
My opinion is that look at what is happening out in the world. Okay, we're not there yet, but it looks like it's gaining momentum, and it looks like we are getting there. My fear is for our people from the informal settlements, people that do not have access to hospitals and doctors and clinics. My fear is for those people who are homeless, sleeping on the streets, who don't even know that corona or COVID-19 exists. And that is my fear, because I think majority of South Africans are living in informal settlements, are living on the streets, and do not have access to all the information that we
Shana, David, shukran so much for your time and your message. We wish you everything of the best. Please look after yourself, and you sound very positive, and it's a good spirit to keep going with all those that might be in quarantine and possibly self-isolation. So there we have it, Shana, David. Shukran so much for chatting to us, and when we come back, we will show you some footage of the reality of what's happening within the informal settlements, and that's our main aim of discussion for today, is what is quarantine, what is the self-isolation, what does it mean to be in lockdown, and are we as South Africans following it? The challenges of the informal settlements will be more just after this, so stay with us. Assalamu alaikum, welcome back. A very good day to you. This is Health Matters Extra, our new daily Health Matters show, and we're twisting it a bit because of 21-day lockdown. It is day 11, and remember the IMA message is, have you washed your hands? Wash your hands properly, hashtag COVID-19. Please do follow their page. They've got some interesting information when it comes to coping at home. The IMA SA, the Islamic Medical Association of South Africa. So our focus today, as I've mentioned, is the informal settlements. We've got a very informative video lined up for you called Life in Lockdown. As we know, poverty keeps residents in informal settlements from staying at home, and that is a bit of a challenge when it comes to the people on the ground trying to keep the residents at home safe, following distance. The News 24 team, which we have to give thanks to, had visited Mamelodi as well as Eerste Fabriek in Pretoria on the 1st of April, day 5 of the lockdown. So please take a watch this.
I didn't see a police or a soldier or someone, and we see people are continuing to walking around.
I'm scared to go there to buy maybe some groceries because I'm scared to be infected.
If there are kids playing outside, it's fine, but we can't keep children inside our shacks. We really can't.
In the morning, I must go out to get a breather, to breathe and stuff. And then I must fetch a water. I must go out with that tap. They told us that that bacteria, it stays for 24 hours. If when I hold this bottle or I hold something, it stays for 24 hours. So that tap is still risky because we are using one tap, and maybe we are 5 people, 6 people. Even toilet, maybe my neighbor doesn't have toilet, we share the toilet. There is no mobile toilets here. Even though there is mobile toilets, we're still going to share. Some of us, we don't know that we are infected or what, and we are living together. And I cannot say to someone when he comes here, said, no, just go, because I don't know is infected or is not infected.
We are only 2 here, and the difficult things is we can't go to the shop during this time because there's a lot of people, especially end of the month, because now we are looking at the social grant. People got paid, and when we go to the shop, let's take at ShopRite, there's a lot of people, they want to buy the groceries, and we are scared because they said there's a problem of coronavirus. For now, I just go to the Pakistan to buy some bread only. Since from Friday, I didn't go out to buy something to eat. Only bread at a Pakistan shop.
It's still life as usual. Unfortunately, people here, they like drinking alcohol. Unfortunately, we don't have. But nothing has changed. I live next door. My mother lives that side. I went there yesterday because we went to buy groceries. I struggled that side, but here now. Yeah, here we're still free. I'm sorry to say that because it's not allowed, but here we're still free.
I'm not worried. I just scared. Maybe I can lose my job. So I don't know what's going to happen after 21 days. Maybe if I go back to work, they can retrench me, and I don't know what can I do after that.
We see like me, I'm working, but now because of this lockdown, I'm trying because I have both a welding machine. I'm doing general repair. I'm doing general repair to survive because now I cannot go to work. We stop at work, and now it's 5 days because me I've got already 6 days. So I'm trying to adjust.
A big thank you to Shante Schatz from the News 24 team, and they produced some brilliant stuff there and understanding what's happening within the informal settlements. Their fear, their concerns, the reality of using one tap in several households, one toilet in several individuals is one of the questions we will be breaking down with our guest online, Professor Shabir Mahdi, former executive director for the NICD. Assalamu alaikum to you, sir, and welcome to Health Matters Extra.
Welcome, Salam. Thank you for having me.
It's a pleasure. Shukran for your time. We know it's a very busy time for the whole world of infectious disease doctors and the medical support staff. So we do appreciate you guys setting time to enlighten our viewers, us, and educate us in the same light as well. So let's look at the reality of South Africa and what is really happening in the informal settlements, understanding the sharing of toilets, one tap for many households. How do they ever get to practice proper self-isolation, and not to mention even the transport challenges, some of the people not following the regulations? What is the state of South Africa with these challenges?
Right. So I think it's a very important question, and the whole concept of social distancing in countries such as South Africa is going to always be a challenging part of the solution. But unfortunately, the reality that we face is that we need to see how best we can actually optimize social distancing. So the type of scenarios which you just showed on your inserts now clearly shows the challenges that we face. Is there anything else that's available to us at this point in time? And unfortunately, the short answer is no. So what we know in terms of those countries that have been successful with containing the epidemic, and particularly South Korea as an example, is that they were able to actually achieve success in terms of flattening that curve without even undertaking a full lockdown of the country. What they were able to do is sort of and have tough measures in place to ensure that there was social distancing, coupled with an aggressive policy in terms of screening of individuals that were symptomatic for any sort of respiratory viral illness, testing of those individuals, isolation of the cases that were identified as being positive, and then tracing of their contacts and a quarantine of their contacts. So when we talk of a lockdown, what a lockdown really is sort of one end of the spectrum in terms of the social distancing strategy. It is really trying to get social distancing to as far as you can go to make it succeed. But like you showed, there are challenges in the South African context and perhaps in many lower-income country contexts where there's high densities of population, overcrowding in a household level for it to be realized in terms of its true potential.
So everybody's talking about flattening the curves. Explain that to our viewers. What does that mean?
Okay, so what flattening the curve really means is that we're trying to reduce the total number of cases, of infected cases, at a particular point in time. Now, there's two parts to it. The one part is what we call an area under the curve. So what you basically showing here as an example is that the part in orange is what we would call the area under the curve. And as you can see, on the left-hand side, there's the graph, the bell-shaped graph, which basically shows us what will happen in eventuality that we don't do anything about the epidemic. That is, we don't try to do social distancing, we don't try to interrupt the transmission of the virus, we allow the viral infection to take its course. And effectively what it means is there will be a huge number of cases that occur over a relatively shorter period of time. In contrast, when we're trying to flatten the curve, what we're trying to do is reduce the total number of cases, but at the same time also reduce that sort of plateau in terms of when the number of cases is going to peak and how far, what the magnitude of that peak is going to be. So that's what you're showing right now. So the way to do this is to try to identify cases early on in the epidemic, to isolate those individuals, and to put the context of those individuals under quarantine. And in so doing, what we're able to do is reduce the transmission of the virus at a community level. And that is really what we're aiming to do. So, but like I said, the ideal part of it is not just flattening the curve, but actually reducing the total number of people that become infected. So even though we're taking it over a longer period of time, the other element of it is to try to actually minimize the number of severe cases that occur over a long period of time.
So,
why is it important? Why is it important to flatten this curve? The reality is that our healthcare resources are limited in most countries, including in high-income countries. And the health system is better able to cope when we've got fewer cases entering into the system week on week, rather than having a huge load of cases entering into the system at any single time point.
So understanding that the Minister of Health has announced contact tracing, going out to communities, especially some of the informal settlements, Alexander being one, Bulkap in Cape Town, there has been a death there as well. Understand to our viewers, is that enough that we are doing with regards to the 50,000 tests that South Africa has already been had performed?
Right, so unfortunately not. The 50,000 tests that have been performed is almost the tip of the iceberg kind of scenario in terms of the extent to which we should be testing. So as an example, in South Korea, and I'm going to refer to the South Korean experience over and over again, because it really illustrates what is required for us to be able to sort of flatten that curve.
Yeah.
What South Korea were able to achieve was to test about one person for every 150 of the population. In South Africa currently, where we tested 50,000 in a population of 58 million, we're testing roughly about 9 people for every 10,000 of the population. So we're way off the mark in terms of the number of people that we need to be testing to be able to identify those cases that are infectious in the community. So up until now, unfortunately, the reality of testing in the South African context is that 80% of those 50,000 individuals that have been tested up to now are tests that have been done in a private sector and not in the public sector, where we know that 80% of the population actually makes use of the public sector. So what is really required at this time point is for testing to be scaled up freely to all individuals across all communities.
Okay.
When someone becomes symptomatic with any of the signs, symptoms that are suggestive of a viral infection, they need to come forward to be tested so we can start identifying and isolating the infectious cases in the community to prevent the infection from spreading to others, including others in that same household. So the longer a person is in a household and remains undiagnosed and is not isolated from the other members of that household, the greater the likelihood that other members in that household will also become infected. So it's about protecting members in the household as well as limiting transmission of the virus in the community.
Okay, Professor Shabir, please stay online with us. We'll continue more of those questions and find out what are those symptoms if you need to have yourself tested. They say even flu-like symptoms, take it serious as if you've got COVID-19. But we'll talk more just after this. Stay with us. Welcome back. Assalamu alaikum. A very good day to you. This is Health Matters Extra, your daily show Monday to Fridays between 4 and 5 p.m. Please do catch us live from our ITV studio. Shukran so much for joining us, and do stay with us right up until 5 o'clock. For now, we're going to continue our conversation with Professor Mahdi and look at some of the signs and the symptoms when it comes to having yourself tested. So welcome back, Prof. Understanding that some people has a bit of the sniffles, and you've mentioned that you want ideally South Africa to have the most testing done because we need to know who's got COVID-19. Talk to us through some of the symptoms of those that do suffer from flu-like symptoms. Is there any comparison when it comes to COVID-19? And are you literally saying, if you have got those flu-like symptoms, go and have yourself tested anyways?
So that's correct. So unfortunately, Jan, there's quite a bit of overlap in terms of the symptoms and signs that an individual with influenza virus would have, or many of the other viruses, compared to the early signs and symptoms that someone with SARS coronavirus 2 will have. And the key symptoms that we need to be looking out for is about 7 or 8 symptoms. And if anyone has more than 2 of those symptoms, they certainly should be coming forward in terms of being investigated. So what we're talking about, as an example, is a fever, a runny nose, a sore throat, a cough, a headache, muscle pain, or impaired sense of taste and swelling sensation. So those are sort of 8 symptoms. If anyone exhibits more than 2 of the symptoms at least, or certainly if they've got a fever of greater than 38 degrees Celsius on its own, that would be adequate reason for them to present themselves for testing. Now, the key question is, where do they get tested? People can't afford to spend 900 Rand or 1,400 Rand to go to a private facility to get tested, and I think that's the reality. So right now, government is working out a strategy to ensure that testing becomes available at particular centers in different communities. And in fact, what government is also toying with is for the healthcare workers to go out door to door to solicit individuals that might be expressing these symptoms, that might be manifesting these symptoms, and actually possibly do the testing at home. So that is something that is fairly liquid at the moment, it's fairly fluid at the moment, in terms of deciding which the best strategy to use to optimize the number of individuals that can be tested.
So we understand that symptoms again, 2 or more of those symptoms, runny nose, sore throat, coughing, fever, I think, that's enough to know.
Correct. An impaired sense of smell and impaired sense of taste, headache, and muscle ache. So those are the sort of 8 symptoms that you're looking at. And any 2 of those should be adequate for someone to actually present themselves to be investigated for COVID-19.
So let's talk about the challenge of the informal settlements and some of those individuals that need to be self-quarantined. I've heard about a week ago a case in Alexandra where an individual had actually known that he was possibly COVID-19 positive. He in fact went around to his neighbours and shared a cigarette and travelled around with the transport. And I've heard the government's going to be doing the necessary contact tracing and testing in Alexandra. What does that mean for individuals like that when they cannot self-quarantine, when there's no space for them, because apparently his house that he was living in, there wasn't even windows. Does South Africa have the capacity of having centres to be used for quarantine services?
So that is exactly what government is working on at the moment. Like you mentioned, the reality for the majority of South Africans is they don't have the luxury of being able to do self-isolation in their own space, simply because they might be sharing the space with a number of other individuals, or the space itself might be too small for a person to stay in, for a person to be expected to stay in 24 hours a day for 14 days or up to 21 days. So government right now is looking at different options in terms of taking people out of those sort of communities and putting them into dedicated isolation facilities. Be it the use of schools, be it the use of hospitals, student accommodation at universities, hotels, or other purpose premises, other premises that are purpose for this particular reason. And that is to actually allow people that need to be isolated to be able to do it in a relatively secured manner. So that is something the government is meant to be working on right now.
Let's talk about being safe. Of course, there are essential services out there. There's medical staff support. I think the US is on about 1,000 deaths a day. And we know that, unfortunately, some of those are medical individuals, the doctors, the staff. How can South Africa learn from this to protect our medical staff and our structures currently?
So I think the first thing to recognize, and this is what we saw in KwaZulu-Natal at Eddington Hospital as well, is that there's 27 healthcare workers that got infected because of one case that wasn't adequately managed when the case presented to that particular hospital. And the whole thing about it right now is that healthcare workers need to become hypersensitized to the reality that they are at risk of being infected. But at the same time, I think that exists to a large extent. But where it is failing in the system itself is the lack of adequate protective equipment that is available to healthcare workers to be able to protect themselves. And what we're talking about here are things such as surgical mask, or what is known also as the N95 mask, as well as other sort of equipment such as goggles, gloves, as well as if they are actually at the cold phase in terms of evaluating suspected cases, or actually looking after suspected cases, then they would need to pretty much be geared with a full spectrum of PPE, which includes sort of a gown, etc. So what really needs to take place now, and I think that's where we need to mobilize resources. If we are wanting to be effective in terms of dealing with the upsurge in a number of cases that are going to require hospitalization, we need to have a healthy workforce. If we don't have a healthy workforce, despite however many number of ventilators we might be able to get into our hospitals, it's going to come to naught if we don't have staff to actually staff those facilities. So there's absolute importance in terms of protective equipment to needs to be provided to healthcare workers immediately. And I think that's where we require a mobilization of resources across the country to ensure that healthcare workers remain protected and are able to then provide some sort of care to the patients that will be presenting to our facilities.
We quickly need to pay the bills, but when we come back, at least before we do that, Professor, could you just explain, are there any safe medications to help with COVID-19?
Okay, up to now, there's no proven medication, no proven therapeutic agent that is known to either protect against COVID-19 or to treat COVID-19. There's a number of studies that are underway, including studies on chloroquine, which is an antimalarial drug, to see whether it can actually be used to reduce the time period that an individual sheds the virus, or that it might sort of might reduce the severity of the illness after being infected. Okay. But those are studies that are currently underway, and at this point in time, there's no therapeutic agent which has been shown to be effective in terms of the treatment of COVID-19.
Professor Mahdi online with us. Please stay with us. We continue this conversation after the short break. But first, we check out what's happening on the ground with NGOs and individuals or institutions, in fact, that needs help. Back in a moment. Assalamu alaikum and welcome back. Now let's chat to one of the organizations that's on the ground. We have Mikhail Collier from South African Muslim COVID-19 Task Team. Assalamu alaikum to you.
Alaikum salam, Haba. Thanks for having us.
Just tell us quickly, who is South Africa Muslim COVID-19 Task Team? What do you guys do? And how can people reach out?
Okay, so the COVID task team, the SA Muslims COVID task team, is a group of individuals, a multidisciplinary task team that has been put together, representing various organizations and individuals within the Muslim community to have a coordinated response to the COVID pandemic that has hit South Africa. So what we've done is in anticipation of this pandemic hitting our communities, we've said that we know that the Muslim community is a very forthcoming and active community when it comes to relief work. So what we thought of doing is to gather all the relief organizations together, as well as some business people, etc., and professionals to look at a coordinated response to how we do work on the ground during this particular period of time. We know that we've got various relief institutions, and what we don't want to have happen is a duplication of efforts and a duplication of our relief that is going to the various parts of South Africa.
Okay, so how can people get in contact with you? And if they really need you in a certain area, what do they need to do?
So what we've done is we formed the muslimteam.co.za. They could go to that particular website. They'd be able to track via live reports all the relief work that is currently being done in South Africa. And then the second part of the web application is that they would also be able to fill in a form to request help, and then we could evaluate that requirements that they've got, and then distribute the need to the various relief organizations, and hopefully those relief organizations, if they've got capacity, will be able to then take up that particular request for assistance.
Great stuff. Mikhail Collier from Cape Town, shukran so much for your time. We will distribute your information on our various social pages. We appreciate your time. SA Muslim COVID-19 Task Team. Please do Google and find out how you can help, and also if you know of someone that needs help. We now also continue the conversation conversation and it's our last few minutes. Please do remember to partake in our WhatsApp line. Any questions, comments and queries on the new Health Matters Extra show. The WhatsApp line is available for that. So please include your questions and we'll try on the next show to get our experts to answer you. So back with Professor Mahdi, we have Professor of Vaccinology continue. And remember, we've got a special message as well from the IMA doctors, and they've got a word for you viewers at home. So let's chat to Professor Mahdi. Assalamu alaikum, welcome back, Prof. Okay, we're just trying to get him on the line. And in the meantime, know that we have to pay special thanks to News 24 team who has given us the footage of a little bit earlier on as we talk about the poverty and how it is unfortunately an issue within the residents of the informal settlements. Not saying that they're also saying that they're not seeing any police, no army, no support, not even aid. Literally they can't even access, other services. They have one tap, one toilet for various individuals, and we need to understand what does it mean to self-isolate and flatten that curve. So let's be all part of that. Stay at home, sanitize, and remember the IMA message today is to wash your hands. Let's check if Professor is back online. Assalamu alaikum to you, Professor. Okay, we're still trying to get hold of Professor and sort of understand what we need to know with regards to testing. He mentioned that if you have any flu-like symptoms, whether it is a cough, a runny nose, a sore throat, even the inability to taste something, you need to go and have yourself tested. South Africa is working on areas that they can do it for free, but at the moment it's anything between 750 and 1,500 Rand. And I've heard also some medical aids will only pay for it if you're positive. So some thoughts around that. We say a big thank you to Shana, who chatted to us earlier and who is in self-isolation, and she's understood to have traveled and been advised by her doctor because of her underlying conditions. So quickly have a look at this. We have a special message from the IMA doctor. We have Dr. Salim online. Watch this.
My name is Salim Junara and I'm a urologist. The coronavirus is real and can cause a person to die. The virus is spreading rapidly. We all have to play our part to decrease the number of people being infected. People that have the virus may not know they have it, and that's why it can spread so easily in groups of people. Keep your homes safe. Do not go out and mix with people and run the risk of bringing the virus back into your home. Do your part to keep our country and our people safe. Please stay at home.
Welcome back. It's our last few minutes of the show. Let me just check with studio if we have time to play our last video. That was when the residents of Khayelitsha found out that they had a case in the area. It was an informal settlement, and the people were not reacting as serious as they should to this COVID-19 pandemic, and still going on with life as usual, and that is in Khayelitsha. Unfortunately, we do not have the time to play that. We have to wrap up in today's show. Please, again, interact with us via our WhatsApp line. It is available. SMS or message us your comments, questions, and queries of what you want to say. Unfortunately, we lost Prof there, but as he said, and to reiterate what he said, if you've got flu-like symptoms, understand that you need to go and have yourself tested. Go to your local government centre, whether it's the clinic or the hospital, and remember to WhatsApp your name to that number that the government has made ready for everybody if you have any questions on COVID-19. Join us tomorrow for another edition of Health Matters Extra. Assalamu alaikum and goodbye for now.